Stacy Whitney, and I am a school nurse from Carl Junction School District, and my colleague Amber Lee Kendrick and I would like to share with you how our school district formed a partnership with a local healthcare system to improve the health of our students, staff, and community. The Carl Junction School District, Jennings, we started out in the corner of the state by St. Louis, and now we're going to go diagonal down to the southwest corner of the state to talk about Carl Junction. And I have a map that I'd like to show you here in a little bit that shows that our school district actually expands out several counties from our city limits, encompassing about 120 square miles. Our district enrollment, to give you an idea of the size of our school, is about 3,400 students. And our free and reduced rate is 37 to 38%. And our students meet the averages across the state when it comes to special health care needs, with about 10% of our students having a diagnosis of asthma, 2% with ADHD, and 1% with life-threatening allergies, etc. Okay, so this is a sign that's in our community at one of our, by our school district and one of our intersecting roads that displays our partnership that we have with the Freeman Health System. And you can see the red is our school district, and we do encompass a lot of rural area, 120 square miles around our town. In 2013, a health needs assessment was performed by our school district RNs, and at that time, what we saw was a disproportionate number of school nurse visits in our schools. We had over 31,000 students visit the health office in 1 year. And keep in mind, we have 3,400 students in our district, so that was a really disproportionate number. We knew that there were barriers to health care for our students and families. We had 0 healthcare providers or clinics in our town, and we lacked public transportation. In fact, the Missouri Department of Health and Senior Services had identified the southwest region of Missouri as having a significantly higher rate of no healthcare coverage, and HRSA identified our area as underserved in the medical and dental providers category. So we knew we had some barriers, including lack of providers. The main healthcare hub of our area is Joplin, Missouri, which had just experienced the devastation of a tornado that wiped out many of the local healthcare providers. Our nursing team identified that improving access to healthcare was a high priority, and we would be best addressed at the community, district employee, and student level. We discussed our ideas with our superintendent, Dr. Philip Cook, in August of 2013, and he recognized the need as well and strongly supported us. We were given approval by our school board to proceed with the process of identifying a solution the following month, and we formed a school health advisory council, and then we toured some school-based health centers in our area and also did some research nationwide. So our subcommittee of our School Health Advisory Council was formed, and we created a request for proposal, or an RFP, in December of 2013. That was approved in February of the following year, and Freeman Health System, one of the 2 local hospitals in Joplin, responded to the RFP in a creative way that we thought was a good fit for our school district and our specific needs. So our partnership began in August of 2014. So this is what our model in our community and our school district looks like. There are several services that Freeman offers to our school district: a local primary care nurse practitioner, telehealth access via iPad between each school nurse and the nurse practitioner at the clinic, and we have 6 school nurses. We have priority scheduling for all CJ students and staff, mental health services, transportation for students to and from school and the clinics. They provided us a dental health resource and a health and wellness resource center. All of this was at very minimal cost to our district. So here's a picture of the school-linked medical clinic that's about 2 blocks away from our elementary campus and about 5 blocks away from our junior high and high school. Freeman Health System completely funded the clinic. They accept private insurance, Medicaid, and self-pay from our students and staff. Our school district isn't involved in any way in the collection of pay for services. It's included in our agreement that students will not be denied services based on inability to pay. So in those circumstances, the Freeman staff work hard with the family. And the health clinic does include, it's a typical size clinic, it includes 4 exam rooms, a lab, and their staff in the clinic is a receptionist, a medical office assistant, and a nurse practitioner. And all of the staff that work in the clinic are Freeman employees. This is a picture of a sign that's located in the clinic stating that CJR1 students and staff have priority scheduling at the clinic. Our school nurses all have a priority number that we can call to the clinic office to notify them that we're sending a student or staff member their way. And this works out great for parents. When they pick up a sick child from school, they can take them directly to the clinic to be seen quickly. And many of our staff members choose to use this clinic for their health needs or their illnesses during their planning time. It decreases a loss of time from school, and in many cases, students and staff that can return to school the same day or sooner after they recover from their illness. For example, without this service, many staff would have had to take a half day or a full day sick, depending upon an appointment time to be seen, if they would have had to travel outside of our community for an appointment. Another example would be if a student was seen in the early morning, they would be able to start their round of antibiotics, for example, and return to school quicker, possibly even the next day. And then next door, we have an Ozark Center mental health services provider for children ages 18 and under. It's staffed with 1 receptionist and 1 licensed therapist. And we have several scheduled mental health appointments for our students that we transport them to this clinic on a daily basis. And what we found with this clinic, we didn't anticipate this need whenever we were working on this, but most of our transportation needs are to and from the mental health clinic. And that seems to be because the parents get the students set up oftentimes with the therapy, but they can't miss work regularly to take them to their appointments. And a lot of these students have once a week, sometimes twice a week if it's a crisis situation, appointments. And so the transportation need was really there with the mental health side. And this is a picture of the van that Freeman was gifted to our district by the partnership. The school district is responsible to provide staff to transport the students. We have a couple of our nurses that are able to drive this van, and then also just this year we hired a health aide that we utilize for transportation, and then also she can work in our nurses' offices. So the district does have a cost for that, and then also all the upkeep on the vehicle. So with parent consent, we're able to quickly and easily transport the students to and from their medical or mental health appointments. And keep in mind, it's really close proximity to the school. It takes less than 5 minutes for us to get them there. And this is a picture of both of our clinics side by side on Main Street of our small town. And you can see by the decorations, this was taken during our homecoming week. And so they're very much a part of our community. And we really feel that our school health model allows services to be accepted or accessible to students, staff, and the whole community. And this is our staff wellness room. This was a part of the agreement in the beginning that Freeman, they renovated at their cost an area that was an old locker room in one of our schools. And the school district provided all the equipment, but they renovated the space. And also as part of that partnership, they provide us with a part-time wellness liaison that works with our school to promote student and staff wellness. And what's really neat about this is we are able to offer it to our staff 24 hours a day. We installed a key card for security, and so there's an outdoor access, and they can use this just like they would any gym that they might pay a membership for, but it's free for the staff.
Okay, I'm Amber Lee. I'm one of the other registered nurses at the school, and Stacy and I partnered to work on all this together. After about 6 months of opening our clinic, we were observing some benefits of improved attendance with students who were seen with priority scheduling and able to return the same day or the very next day. We had fewer staff absences. They were able to go during their planned time as opposed to taking a half day or a full day to go to these appointments. We also were receiving some positive feedback from parents regarding accessibility and their ease of getting all those school immunizations that were needed. After 3 years, actually in November after we left our meeting here, we went back and we said, we really want to get some staff feedback. What do they think after 3 years of this clinic being open? So we sent out a survey, and 65% of our staff reported that they or a family member had utilized the services at our clinic. 66% of them felt that the clinic accommodated their planning time. 61% felt that the services did help reduce that total time away from work. And what we were really most excited about was that 96% of those surveyed felt like the services had helped improve the access to health care and mental health services for staff and for students. In Carl Junction, we really didn't have a lot of an attendance problem. Back in 2012, before we had started this adventure, our attendance rate was in the 95 percentile. It has continued to stay consistent at 95. We've got 95.7 in 2012, and in 2016 we're 95.3. So it's just, we're not seeing a lot of fluctuation in that as a result. But in what we observe, we know that our high-risk population of students are returning to school sooner. So we were finding data to support that was very difficult for us with an attendance rate that was already pretty spectacular. So remaining challenges and plans for our future with this clinic, we really do find it challenging to collect data that will help us provide sustainability of the clinic. There's a lot of reasons for that. Because our clinic is managed by our local hospital provider, Freeman Health Services, there's a lot of HIPAA laws in collecting that data that exist that can't be really shared with the school. And because our clinic serves the community as a whole, and parents can bring their students in even without a referral from the school nurse, that's also difficult to decide if this is a school referral visit or if it's a just off the street community visit from that family. We also would like to incorporate some networking between school health clinics in our area. We're excited to be here. We feel like this is a good step in networking with other clinics that have school-based health services. We are working to secure a preventative and restorative dental program. We used to have that. We still have that as a component to this, but it's more for the emergency services, and we really are looking for some funding to have a more sustainable preventative dental service clinic. And then, and I'll explain a little bit more on this one, but we're looking to increase parent and local primary care provider support and improve our telehealth services. So as far as the parent support goes, in the initial startup, parents as well as some of our staff members expressed things such as, the school shouldn't be involved in health care, and my child's health is not the school's business. Or as a school, as a teacher, or as a school nurse, is this really my job to help them get to a clinic? And I think that a lot of that has dissipated just with the patients and working with them. And for those who work in schools, we know they come regardless, and we have to meet that need and help them be ready to learn. And also, at the startup, some of our local primary care providers, some of the pediatricians, they didn't understand the purpose of the clinic and how it could save time and save our parents and lower income families that drive and that gas money from Carl Junction community all the way over to Joplin. And so it was seen as competition, or that they were going to steal our patients. So it took some work with that and some communication with office managers in the area to let them know that that wasn't the case. This was just an additional service offered to these students to make it more convenient and ease that accessibility. So that has really improved now, that relationship between our clinic and the local primary care providers and pediatricians. So patience and time was really critical for us to resolve some of these issues that we initially had. And for us, we felt very fortunate because the staff that we have in our community health clinic and in our mental health clinic are all staffed by parents of kids in our district. People who are vested in our community, people who have interest in improving the health of our community and not just a provider. So that makes a difference in those relationships and those conversations that take place and easing those fears that initially come up. And so I think that involvement was really important. At our staff clinic, our nurse practitioner, she's just got this bedside mannerism and etiquette with her patients that I felt like we were very lucky that we had someone who loved our community as much as we did and had that same passion to increase the health in our community for our staff and our students. And then just continued close communication, especially when you work with an outside hospital or an outside healthcare clinic, that continued communication, because their goals are sometimes different for an outlying community clinic or an outlying health clinic than what our goals as a school district are. So we have to constantly have those conversations of how can we improve student health and benefit you as a hospital system. So, and it's creativity every step of the way. We've tried to creatively come up with solutions to bridge those gaps and make sure that all of these services are accessible by our lower income families and families in need. And then at 5 years, we will be looking at that contract again, and we're hoping to have some more networking meetings and reevaluate those services and improve and build on what we have made so far. We also have telehealth services, which is an iPad that we can use, and we're looking at ways of how can we improve patient education, our asthma education. We're also looking at those ideas in the future of how those could be better utilized. So we're very short compared to Jennings, I'm sorry, but we've saved time for questions if you do have any. When you do open your clinics, the best part, I think, is just getting to be so proud of your results and the way that you can serve your students and better meet their educational needs by, taking care of that health need. So we've shown some of our local newspaper ads and things that went out, the stories that we made sure the community got to hear about how this was benefiting all of us. So that's it.